So Lori, the next thing I'm going to show you is actually not a big problem for you, but it could be, especially once you start walking, because walking more, you're already doing a little bit. But when you're walking, your hand is down by your hip quite a bit, and the fluids tend to go downhill and they don't go back up very easily. So I'm going to show you about 4 or 5 different strategies to keep the hand from getting swollen. It's important that it's not swollen, because if you're trying to move your fingers and it's just full of fluid, then that's a problem. They can't move because they're kind of stuck. So the first strategy for getting the excessive fluid out, and again, yours is very good right now, is to have your arm in a good position with your hand as high as your heart. If it spends a lot of time down here, fluids go downhill, there's not a lot of muscle action to pump it back. So you get stuck there. So whenever you're sitting in a chair, could be at the couch at home or laying in bed, is you have your hand up on level with your heart, or even a little bit more is even better. But again, you want everything to be comfortable. So elevation is the key. The next thing is positioning. Now, if your hand is like this, you can see that the skin does not move at all. Any fluid that's in here will be trapped underneath. But if I move your hand this way, you can see the skin's a lot looser now. Now fluids can move back and forth more easily. So positioning for not just elevation, but the wrist and fingers like this. That's very important. Again, you could use a ball, you could use a stuffed animal, pillows, anything. One of my patients used their dog to position their arm. So anything to get it up higher than the heart and in this position. So there's positioning. Next is exercise, which we covered in one of the other chapters. Getting everything moving, both passively, you know, your family moving you or you moving yourself, or actively, you trying to move your own body. So elevation, exercise. The next one is massage. So again, if let's say you and your family are watching TV, they could put some lotion on and just basically milk the excess fluid back towards the heart. Just like that. Very soft, gentle. They could use lotion. And you can see I'm basically squeezing your hand and milking the fluids back this way. So I usually combine it with elevation and massage, just like that. Very good. So elevation, exercise, massage. The other thing, and you don't have to do this, but some of my patients do, I'll use ice to help control the swelling. Now, I'm not going to have you actually do this, but I'll show you what it looks like. I'll put a bucket of ice water on a footstool right about there, and, thank you, you're going to reach into the bucket for about 3 seconds and then come out again. So I'd have towels right here. Go ahead and reach in and come out. It's very refreshing when you do this. And you would pause for a bit, and you're going to do that about 4 times, and you're in the bucket for only about 2 or 3 seconds. That'll do a terrific job of basically closing some of those blood vessels and getting the hand to be in a much better condition in terms of swelling. You don't want to leave it in the water for too long, because it'll start to ache like crazy. So when you do this with your family, have them do it with you too, so they can feel what it's like. Now, one of the other things that sometimes therapists will use for swelling is a compression glove. Again, I'm not going to use it with you because you're not having that issue at this time, and I hope you never do. But some people will use a glove. Now, the glove, if it is put over a swollen hand, won't do very much. But if they can get the swelling down, then put on the glove and wear it during the daytime, that sometimes helps get the swelling down just by compression. It's just like your compression socks, same idea. So again, elevation, massage, exercise, maybe ice if need be, and maybe a glove if need be. But right now, you're getting by with elevation and the exercise and just a little bit of massage. We're not spending much time on that. So you're doing great in that respect.